Hi, I'm Dr. Laurel Griffin. I'm here at Precision Chiropractic West in West Des Moines, Iowa. Here we practice Atlas Orthogonal and upper cervical chiropractic technique. In the office here, we do a lot of work with some of the more extreme cases, more neurologic type cases, and one in particular I want to talk about is vertigo. So many people in this world have vertigo, and I see a great number of them here. I want to touch real briefly on the type of things that could be causing your vertigo. There's three different ways that a misalignment at the very top of your neck could cause vertigo symptoms. The first one is very simple, and that's just tight muscles in the neck. When the muscles in the neck tighten up or stretch to an extreme amount, there's a tiny structure within the muscles called mechanoreceptors. Those mechanoreceptors can actually cause a dizzying response in the brain. So just a misalignment of the neck can cause that type of symptom. Also, the atlas bone, the very top bone of the neck here, is connected about this close from your inner ear and can pull directly on the structure. It can also affect blood flow and nerve flow to your inner ear. And that way we can affect vertigo symptoms just by affecting your inner ear. Also, if it's pulling directly on the inner ear, it can cause crystals to dislodge or cause them to not be able to be corrected. For instance, if you've been to physical therapy and it was not successful, usually it's because the atlas bone is pulling on the inner ear itself and isn't allowing it to isn't allowing the Epley's maneuver to correct the problem. The last way that an atlas misalignment, which is the top bone of your neck, the last way that that can cause a vertigo type symptom is by affecting blood flow or cerebrospinal fluid flow within your brain. If you're not getting enough oxygen to your brain, or if you have too much pressure built up within your brain, it can make you dizzy. It can make you lightheaded, all of those things. And we can correct that very simply with an atlas orthogonal upper cervical adjustment. There's no twisting or popping involved at all. We don't have to do that because we're precise enough. We use very high-tech, highly scientific method, very safe. All of our adjusting is done within the normal range of motion at the joint. I talk a lot about the Atlas Orthogonal technique in videos and in writing on my website, so you can learn more about that specifically there. But vertigo patients that I've had, every single one of them, since we've started focusing on vertigo, has had improvement in their vertigo symptoms. Most of them have completely gone, some of them after the first adjustment, and has not come back. One in particular, I had a patient who was so bad with her vertigo that she was in a wheelchair, and after we got her stabilized, she was actually able to hold her head up straight for the first time in years and returned to her neurologist who, for her checkup, who told her, said, "What are you doing? This is awesome. Give me that doctor's number." So we were able to be put in contact with that neurologist for that patient, or through that patient. So multiple other people are just doing so well with the vertigo symptoms, and they're also having the good side effects of decrease or elimination of headaches and neck pain too, and they didn't even come to me for those things. They came for the vertigo. So if you have vertigo and you're just wondering if it can help, it can, and we help most people with it. We don't have as many people talking on video who did vertigo or had vertigo who came here. They tend to be shy. They don't want to be on video, but we've got every single one of them has been improved in their symptoms, and we've got that documented in both their record and their progress reports, and some of them in a written testimonial as well. So you've got nothing to lose except for your vertigo. Go ahead and give us a call and we'll see what we can do for you. Thanks.